observing the lockdown, staying home in your hostels or maybe even in your rooms, and are all safe. So the lockdown has been in effect for about 2 weeks now, and the number of COVID-19 cases have gone up, and we are in a critical phase. What should our containment strategy be going forward? How do we better cope with the situation at hand? That's what we're going to discuss in the big picture. Joining me on the program today are Rajib Dasgupta, Professor, Center for Social Medicine, JNU, and A.K. Bhattacharya, Editorial Coordinator of the Business Standard. Thank you to both my guests for joining me on this edition of the Big Picture. Mr. Bhattacharya, let me begin the program with you. If we call it a silver lining right now at this point in time, 700 odd districts, but there are about 80 districts that have been identified really as hotspots and where the virus is spreading the most and not uniformly across the country. That having been said, what should our strategy be going forward?
I think the strategy for the coming days should be guided by two key factors. One would be that how we can actually ramp up our testing capacity. Already we have increased the testing capacity to around 10,000 tests a day. But we are still, that level is hopefully adequate for a country of our size. So therefore, the strategy going forward would be raise the country's capacity to do more tests, because more tests will give you better data to fight the virus in the coming days. And also more data after the testing will give the policymakers greater confidence. And even from the economic policy perspective, this gives the people who are managing the economic impact of the virus greater tool, more effective tool to handle the crisis. And the second part of the strategy going forward would be to see in what way the lockdown, in whatever form it takes place from 14th of April, does not bring down or bring the economic activities to a complete standstill, because it is important to tackle COVID-19, is very important, but it is equally important to make sure that the wheels of the economy does not continue to remain shut, because if you do that, then you will have to face a larger calamity. So therefore, we have to see in what way the lockdown can be phased out or staggered or maybe restricted to those 80 districts. But managing that staggered lifting of lockdown will require great management skill and governance efforts. So therefore, we need to keep our fingers crossed and stay focused on proper planning with the best advice available from across communities, in a sense that not just necessarily within the government, but from the think tanks, the NGOs, the intellectual community, from experts who were part of the earlier governments. So it has to be a truly national effort to make sure that the next stage of the lockdown is managed and implemented with the least adverse impact on the economy and society.
Absolutely. Taking the discussion forward now, Dr. Dasgupta, if you look at these 80 districts or so, there are several other parts of the country where there are no cases at all reported in many districts. So, what's the reason behind this? And should our concentration be on these hotspots and these most affected districts right now, or should we broaden and widen the scope?
The pattern of hotspots, or the emergence of pattern of hotspots, is what it's been in most countries. In India, for example, Kerala, which received the first batch of Wuhan returnees, there were only 3 cases. There were also a few students from Tamil Nadu who were kept under quarantine in Kerala, who returned from Wuhan, and then later a few from coming. But this particular batch was very successfully contained. There were, of course, young students. There were no complications, no adverse outcomes, and so on. After that, Kerala had a relative period of quiescence till the next batch of travelers came in both from the Gulf countries as well as from Italy transiting through Gulf countries. And then you have the hotspot of Kasaragod, northern Kerala, where this person who, I'm not sure whether it didn't report or it wasn't monitored adequately. I'm not very sure on that. But the fact is that he kept moving through the district. He kept attending various functions and so on. And the district administration did finally manage to get it under control after some Herculean efforts. The other pattern you have is in Bhilwara, where there was initially an elderly patient who was not really suspected of COVID, but then it spread to the doctors and the healthcare workers in that particular medical institution. Then it spread further. And again, with a lot of efforts, Bhilwara managed to contain it. It's under control at present. In fact, it's gone down. And then you have the third type, which is the Nizamuddin religious congregation, spread to very large parts of the country, including some states in the northeast who, but for this, actually had their first case. It went back to other countries such as South Africa, to Indonesia, Malaysia, from where many of the delegates came. A very similar event happened in France earlier, from where it spread to Germany. It spread to as far as Burkina Faso in Africa. So these are the broad patterns how hotspots emerge. The challenge is, of course, how to contain hotspots. And what's the next step of moving from the current phase of the lockdown to a more focused approach? We'll talk about it.
Absolutely. So hotspots, and since we are here, Mr. Bhattacharya, how do we contain these hotspots? Now it's going to be a big challenge. You brought up the issue of governance. The Prime Minister had a conference call like we are having right now, but on a much larger scale, of course, with all the chief ministers of the states to discuss and to come up with a strategy. You spoke about the economic aspects as well. Keeping all of this in mind, what do you believe that we should do with these hotspots? Do we enclose them, bypass them, and let normal life go on? Or should we look at a bigger picture?
Well, my assessment is that we are still very much in the early or the late early stages of this crisis. And we are yet to see the full manifestation of this virus, in the among the Indian people. So we have to be very, very careful when we relax the lockdown rules in any part of the country. Remember that after the 21-day lockdown, if you lift the lockdown in any part of the country, with the kind of population that we have, there will be a tremendous surge in people coming out on the streets and trying to resume economic, social activities, especially after they have been locked down for 3 weeks. So therefore, it's very, very important that even the nature of activities that are allowed to be continued, even outside the lockdown zone, should be done with greater care and greater planning. Imagine a situation that areas that are not hotspots, but there are people who are probably asymptomatic. Now they are capable of creating and transmitting that disease. So what were not hotspots could well become hotspots if you allow lifting of the lockdown without careful thought. So I think while it is true that in these 80 districts you need to impose the strictest possible lockdown and continue that lockdown, but making sure that the economic needs, the basic, the essential services needs, the needs of the poor people, especially the underprivileged, the migrant workers, the women, they are taken care of through greater state intervention. You do that well in 80 districts, but in the remaining around 670 odd or 660 odd districts in this country, you cannot assume that you will lift it in one go. You need to employ the same graded response, same graded approach that we did when we approached this entire COVID-19 crisis, which is that lift it gradually and allow in some activities to be continued or to be resumed, but in opening it up in one go would be inviting disaster in my view. So therefore, continue the lockdown in 80 districts and gradually lift the controls and the lockdown in phases over nature of economic activities. For example, I personally feel that congregations of people should still be banned in almost all districts in the country, because it is the congregation of people, and when I mean congregation, I mean religious congregation as well, should be strictly a no-no. The second thing should be that anybody who gets out of home should be allowed to get out of home only if he is properly wearing masks. Going forward, maybe one should look at the idea of wearing gloves. So I think we should not just lift the lockdown because of these, that the hotspots are the only areas of concern. The other parts of the districts and the country are not an area of concern. That will not be the correct approach. You allow to lift the lockdown in other districts, but employ the necessary safeguards and precaution and lift it in a staggered way on certain economic activities, certain social activities, step by step.
Sure, certainly. All right. A few more economic aspects that need to be spoken about. I'll come back to you on that. But, Dr. Dasgupta, as far as containment is concerned, as far as ensuring that it doesn't spread, initially, of course, we were screening international travelers and we knew that the virus would come from outside. Now that we have it here and now that we have identified some of these hotspots, what is the biggest challenge going to be in trying to ensure that we keep it locked in there and try and get rid of the virus on the whole?
Well, the challenges are broadly twofold. One is, of course, how does one allow staggered or a graded resumption of economic and other social activities, which includes supporting the provisioning and social support services. I won't go into that detail. We have already discussed that. Now, as far as managing the existing hotspots are concerned, the textbook prescription now, is to move from what is a general lockdown across the country to what is called a cluster containment strategy. So in a cluster containment strategy, if you like, for example, we have this 80 odd districts, and actually the newest bunch of cases are in 62 districts. So this administrative unit of a district will actually become what's known as the containment zone, which would actually follow what's now in force, which is nearly a general lockdown. If you see over the last 24 hours, one or perhaps even two cities in Madhya Pradesh has moved into a stricter lockdown after a surge in cases there. So there will be a containment zone and there will be a buffer zone, and there is a drill of what is known as the perimeter management, so that cases from within don't go out and from the persons from outside who come in are regulated more strictly. This is what many of the European countries or or districts or localities within those are actually being managed with. So it's containment zone, buffer zone, and perimeter control, and the legal frame which comes from the Disaster Management Act, state, center, district coordination, etc. Then, of course, is how do you enhance the testing capabilities, and then finally to a three-tier arrangement where the mild cases will be in temporary makeshift hospital facilities, but they're not really hospitals. They can be converted guest houses, even stadiums. Some states have taken up stadiums, districts have taken up dharmshalas and so on. And each state or district is actually getting those ready. That's really for the mild cases, which are purely temporary makeshift arrangements. Then you have dedicated hospitals or a dedicated block within a large hospital where the less serious cases would be put in. And then, of course, you will have the severe cases who will require intensive care support, which will go into specialized units. And there is logistics, management, pharmaceuticals, personal protection equipment, planning, stockpiling, distribution, all of these very complex operations. But what's also got to be added is a very large quantum of care, which is now actually in complete limbo. So, for example, those on long-term care of tuberculosis, of, let's say, kidney disease who require dialysis, pregnant women who require antenatal care, and so on and so forth. Now, many states, what they have actually done is to make arrangements for the delivery of these chronic care medicines at the doorstep. And the fact is that all states are responding to these needs, but even that is a very big challenge in itself.
Absolutely. There are several challenges. There are challenges galore. It's important that we all work together and all stakeholders are taken forward, is what Mr. Bhattacharya said as well. So those are some things to be, to keep in mind and to take forward. Now, talking about going forward, Mr. Bhattacharya, the economic implications, really, let's talk about that, because in the lockdown, what's happening is manufacturing has taken a hit, and supply chains within the country itself, forget about global supply chains, but within the country themselves have been impacted. So how do we ensure that, the food and the essential supplies keep going? Because many of these manufacturing units, in some way or the other, are associated, maybe not directly, but connected to essential services as well.
Well, I think it's a very important area of attention in these times of the COVID crisis, and I think we need to look at it in two different clusters. One is how do you make sure that the manufacturing sector or the segments that produce goods and services, they are given the necessary support so that they can get back gradually into their normal activity cycle. It will not be easy because getting the economy back on the rails will not only be a time-consuming affair, but also it will remember that the COVID-19 has struck a blow to the ordinary way of doing business. So COVID-19, even if it is contained and mitigated, my sense is that it will bring about a kind of a structural shift in the way businesses do their businesses. For example, I think the aviation sector will start reconfiguring their costing operations. The services sector will look at the various new opportunities and new areas which they have lost out to. The manufacturing sector will have to revisit the entire ways of their doing business. So I think the government, the policymakers must come in and provide a kind of a umbrella of financial support so that the businesses can readjust themselves to this new world post COVID-19. So that will require a major substantial fiscal stimulus, so to say, that money has to be provided for. That is one kind of so that disruptions are limited. The second kind of support is required is for the people who are at the lower end of the economic spectrum. Now, you can safely assume that there are about 430 million Jan Dhan accounts, and all the Jan Dhan account holders can be classified as people who are the underprivileged lot. Now, if you want to give them the kind of necessary economic support to keep their consumption pattern going at the basic minimum level of keeping everybody and sitting together, you need to give them at least 9 to 10,000 rupees over the next 3 months by way of a cash handout to their Jan Dhan accounts. And that will mean a kind of a total cost of around 3 lakh crore. Now, if it is a 3 lakh crore of stimulus given to the 430 million account holders, my sense is we will not only have kept a large segment of the underprivileged people, their body and soul together, but also would have kept demand in the economy going, which will have a positive spin-off effect for economic activities in generally. And finally, I would say that you cannot underestimate the importance of spending a lot more money at this point in time to beef up your healthcare infrastructure, which needs, for example, you have only 40,000 ventilators, you might need about at least 100,000 ventilators or even more, depending on the seriousness of the crisis. So do you need to make quick investment in creating, and I understand that investments are already being made by private sector to produce more ventilators. Similarly, on the healthcare infrastructure, if there are only 20 lakh beds in the country, do we need more beds? By how many more beds do you need? So I think the healthcare infrastructure, the economic needs of the underprivileged, and the business needs of those economic participants, these are the 3 areas that will require greater attention from policymakers in terms of a kind of mitigating the impact of COVID-19 on the economy.
Absolutely. And Dr. Dasgupta, I'll get a closing comment from you on the program, on the best way forward in dealing with the situation at hand.
Well, the best way forward is actually being able to make the correct trade-offs to cushion those who are the most underprivileged. The medical care sector will continue to face a dual challenge of 1, responding to this epidemic, and 2, to keep other so-called non-essential, which is now being relegated to non-essential medical services, to keep those also going, because that's already a very large need. It's a very large population. The public sector health services are stretched, and with the economy going down, I do not really see the affordability to afford private sector, even at the level which we had earlier going on. So the state or the public sector now has certainly a much larger role than it was playing, both from the pandemic point of view and the other non-pandemic essential medical sector needs. And this is equally true of the research arm of institutions. It will need to balance the ongoing research commitments and plus find new resources and new commitment to pandemic research and strengthening the health services in general.
Absolutely. All right. On that note, then we'll have to call it a wrap on this edition of The Big Picture. Thank you, gentlemen, for joining me on the program and sharing your views and putting things into perspective for us. What's coming out of this discussion is that we need a national cooperative effort, and all stakeholders need to come together if we have to fight this particular pandemic. The stage ahead is difficult, but with major governance efforts and with major efforts from all the stakeholders, it is something that we can conquer and something that we can overcome, is what the panelists are suggesting. With that, it's a wrap. See you again next time.